Ask the docs, ask the docs, ask the docs, and we'll answer.
Hello out there, social media world. We are back with another episode of Ask the Docs. I'm Dr. Martin.
I'm Dr. May. We love doing this. Thanks for your questions.
Yep, thanks for your questions. And so we've got two really good ones today. Our first question is, can you explain what uveitis is and how it is different than iritis? What causes this? All right, that is a great question and a huge question as well. So get you some popcorn ready. This episode will be about an hour and a half. Yeah. The uveitis and iritis sometimes can mean the same thing, and a lot of times they do. So patients will come in and they say, I have a history of uveitis, or they say, I have a history of iritis, and we're thinking, okay, we know what that means. So in general, or probably the most common type of iritis or uveitis is called anterior, or in the front part of the eye. And itis, after anything, means inflammation. And uveitis is inflammation of the uvea. Iritis is inflammation of the iris. So most people remember from middle school science that the iris is the colored part of the eye. The uvea makes up the iris and then also some other parts of the eye right behind the iris. So it's just a little bit broader area. And so when you say you have iritis, that's kind of a more specific name for a type of uveitis. Now, a lot of times we have to treat that inflammation with steroids. So most of the time we're prescribing steroid eye drops to help calm down the inflammation. If you have recurrent iritis or uveitis, then that could mean that you have systemic inflammation. So this could be rheumatoid arthritis, just lupus, several inflammatory or autoimmune disorders. And so there's some blood work that can be run to try to diagnose that. And then also we work closely with some specialists in that area to try to really pinpoint the diagnosis and treat you appropriately. But if symptoms of these would be like if your eye just aches, it won't be necessarily scratchy, but just almost like a toothache in your eye, real sensitive to sunlight and that sort of thing. There are other types of uveitis that are called posterior uveitis, and that's in the back of the eye. Those sometimes will not cause like an achiness, but that's stuff that we see during a dilated exam. So that's yet another reason to come in for a yearly exam, and we can check for those symptoms.
A lot of times when people think of uveitis and iritis, a lot of times it's the same thing, and they're very treatable. But if there's an underlying condition, we need to figure it out what it is. Okay, second question. And this was not as much a question as it was somebody that commented. They said, please tell people that have diabetes how important it is for them to have their eyes checked every year. And I would completely agree with this. Diabetes.
It's not that important. It's not that important.
Diabetes is the leading cause of blindness in people under the age of 55. So it's a very serious condition. Basically, when the blood sugar is elevated, it damages the blood vessels in the back of the eye. And that causes damage to the blood vessels, which can also lead to bigger retinal problems. And so that's why diabetes is such a big deal. Having them dilated every year is going to be the best thing we can do to make sure that the diabetes does not cause any vision loss, because we'll be able to see those changes. And there's usually a progression. You don't go from no retinopathy, meaning damage to the retina from diabetes, to the worst retinopathy that's going to cause blindness. It's usually a 3 to 5 year progression if you're really out of control. And if you're pretty good with your control, usually it takes longer than that to progress. So we'll be able to see those changes well before they're affecting your vision. So that's why it's so important, if you have diabetes, to come in, let us do a dilated exam, let us talk to your primary care doctor so that we can stay in communication with your care.
If you're having broken blood vessels in your eye, it's happening throughout the rest of your body too. So it's not just isolated to your eye. It's just the eye's the easiest way to look at those blood vessels. Your doctor can't just hold up a lens and look at the blood vessels in your kidneys, but the same thing's happening there. If it's happening in your eyes, it's happening in the rest of your body.
Absolutely. Yeah, great question. So thank you for that. All right, the last thing we've got today is a little bit of a treat. So we had a professor of poetry and philosophy at Brooklyn College in New York. Her name is Professor Irene Brodsky. She wrote a poem to be sung to the song I Could Have Danced All Night from My Fair Lady. And so I was going to sing that as part of the closing part of this video. So
this is a special treat because I have not heard this yet.
So I'm going to sing it.
Do I have to be the lady, like the eyelashes?
I could not see all night, it was an awful fright, and so I went to the dock. He was waiting for me with new machinery and frames ready on the spot. I only know he made it so easy, and all at once I could see the letter E. I only know in the dock he gave me such a shock. Now I can see all night.
Oh, wonderful!
That is from Professor Irene Brodsky. So thank you for that.
Cool.
That was
That's
really
awesome.
cool
Yeah.
of you to send
Very
that in.
nice lyrics.
Yeah, we appreciate that. So thanks for joining us for this episode of Ask the Docs /
My Fair Lady, My Fair Doctor.
My Fair Doctor. There you go. All right, take care. We'll see y'all next time.